Welcome to the Head and Neck Cancer 2020 video series, presented by St Vincent's Hospital Sydney, the Kinghorn Cancer Centre and St Vincent's Private Hospital Sydney. Innovations in Radiation Therapy with Lisa Gia.
Just before we leave the land of radiation therapy, I couldn't resist showing you what happens backstage. What happens out here while the patient, like me, is inside being treated under the mask. And so it's my great pleasure to introduce a radiation therapist. Can you introduce yourself and just explain what you do out here as a radiation therapist?
My name is Lisa, I'm a radiation therapist, and what we do is we sit out here in the control room watching you as you're inside having your treatment. Depending on the patient, we can do various things. We can leave you alone so you can concentrate. 2, we can probably play you music, whatever you like. 3, we can talk to you throughout the entire process. Or 4, sometimes, occasionally, we can sing to you.
And I don't think you're going to sing for me today, but seriously, do some of the radiation therapists sing?
Absolutely, if they've got a beautiful voice, unlike mine.
But Lisa, does that tell me that to work well with a head and neck cancer patient who has to manage this experience of wearing the mask, you try to develop some kind of relationship with them?
You absolutely do. You need to have a real understanding of the patient because no two patients are the same. So you really need to spend the time with them to understand what it is they need, have a discussion, and even set the expectation early.
Why is the expectation important?
It gives the patient a bit more control. It allows them to really understand what is to come and know that there are options. Being in that room on your own is very terrifying, so we understand that you need some guidance, and we are here to do anything that we can to make it as easy as possible.
And do you think there's a place for models and pictures as a way of showing the patient what's going to happen?
In our day and age, I think the more pictures, the more videos and models, the more information the patient gets prior to coming in, the easier it will be once they're here.
Why?
It gives them information. It gives them ability to ask questions. It gives them a source just to look back to and even show their relatives so that their relatives understand what they're going through and share that with the family and friends.
For patients who might be watching this who hasn't had their radiation treatment yet, any tips you would offer them on ways that will help them cope with this experience? They might have to have 30 sessions or even more. So what's your tips from watching lots of people go through this treatment?
My number one tip is just talk to us. A lot of radiation therapists unfortunately find out 1 week or 2 weeks into treatment what they actually need. So come talk to us, ask lots of questions, and we will do the same to help you back.
Look, that is such good advice. I waited 4 days before I explained that I was finding it desperately difficult. And once you knew, I was given mild sedation because I was very anxious. But also I listened to the same 4 songs. I went and saw a psychologist who gave me things to think about. The nurse came in and held my hand while the mask was put down. And I look back now and I so wish I'd spoken up sooner.
That's it. And there's always an option. There's always an answer and there's always going to be a solution. We just got to do it together.
And just before we finish, I know that you're supporting the patient. It's fantastic to hear how focused you are on that. But you're also delivering the treatment, aren't you, out here?
Correct. So we're making sure outside the room that things are very accurate and stable. So we're never looking away from you at all. There's always 2 of us outside the room. So one of us is often the one looking at the technical detail and the other radiation therapist is the one looking at the cameras, making sure you're okay.
Well, Lisa, I'm just so grateful to talk to you. And why were you attracted to this work? And you enjoy it. You seem very focused on the patient. What do you get out of it?
I think it's satisfaction that I can help my patients, but also it really hits hard for me because I do have personal, relationships to my parents who have had cancer before. So I think if you speak to a lot of radiation therapists and nurses and anyone in this field, there's always a personal attachment as well. But really, number one is there to be for our patients.
Okay, because I do feel there is a special caring element in cancer care that is very, very comforting when you're the patient. Look, thank you so much.
Thank you.
Head and neck cancer treatment innovations, improving survival and quality of life. Providing up-to-date, evidence-based information for everyone in the head and neck cancer community. presented by Julie McCrossin, a head and neck cancer survivor. Media production by Daniel Taylor at Inside IT. Celebrating World Head and Neck Cancer Day, 27th of July, 2020. Innovations in surgery, radiation therapy, chemotherapy, immunotherapy, dental care, managing distress and recovery, managing mask anxiety, remove the mask research, Aboriginal and Torres Strait Islander patients, family and community. Discussions of innovations that are improving survival and quality of life for patients with head and neck cancers. The 2020 Head and Neck Cancer video series. Presented by St Vincent's Hospital Sydney, the Kinghorn Cancer Centre and St Vincent's Private Hospital Sydney.